Right. Hello, everybody. Thank you for joining us for the DNP Advanced Practice virtual information session. My name is Tom Kresh. I will be your host for the event. I'm our director for graduate admissions. The event should take around 30 to 40 minutes. We have a great presentation from Dr. Park that will help provide some further detail on what your experience may be like in our program. Whether you're watching live or watching the recording, we definitely appreciate you taking time out of your busy schedule to join us today. If you have any questions along the way, please let us know. And if you're watching the recording, please feel free to reach out to Dr. Park or I. We are happy to help in any way. But before we go any further, Dr. Park, would you mind introducing yourself?
Sure. Thanks for joining. I want to say that as well. My name's Lori Park. I am the director of the DNP program here at Commonwealth University. I have had my DNP degree since 2015, and I did my research project on providing online education to women with gestational diabetes versus in-office education. I am family nurse practitioner trained, but I've worked primarily in women's health for my whole career. And right now I'm working in the breast health clinic at Geisinger in Danville. I teach in nurse practitioner and DNP courses here at Commonwealth. And my research interests primarily, they focus around women, diabetes, women's health, and the use of complementary therapy by breast cancer patients is a lot of what I've looked at. So, yeah.
Excellent. And Dr. Park, how long have you been at the university?
Oh, yeah. This will be my fifth year as full-time faculty, and I was adjunct faculty for a couple of years before that. And then I've also been an instructor at other universities prior.
So you've been very busy.
Yeah.
Great, great. Well, thank you, Dr. Park. So I know you have a presentation ready to share with the group.
Oh, do you have
Um,
it to pull up, or I can pull it up here? Hold
Yeah,
on.
so and while you're bringing that up, just so everybody knows, again, we have a presentation that will walk through some of the more important topics that are going to be relevant for students who are looking to get their doctorate degree in nursing. And then we'll open it up to a Q&A afterwards. You know, we recognize this is probably a really big decision for you. We want to make sure that you have the opportunity to do your due diligence and kind of investigate what your experience will be like. I think we're both, Dr. Park and I are pretty confident that our program has a lot to offer, but we want to make sure that we have a program that fits what you're looking for. One of the things that we're proud of with the Briner School of Nursing is that we really truly do have something for everybody, all the way from an ASN program, all the way through multiple DNP programs. So we certainly have a lot to offer. And Dr. Park, if you need, I can bring up the presentation if that will be easier.
No, I got it. I was just trying to figure out how to get it to share. I think I got it.
Okay.
There we go. Do you see it?
Uh, yes.
No?
Yep, we're good.
Oh, okay. Oh, whoops. Now I went too far. Okay, well, that's just the cover page anyhow, telling you this is the virtual information session about our DNP advanced practice track. So a lot of times I get asked, why would I go back for my DNP degree, or why a DNP degree in advanced practice? And first of all, this is the highest degree or the culminating degree for a nurse. So you are just showing that we can do that and we can achieve high things and good things. So, and obviously expanding career opportunities is one of those things. And in future slides, I'll talk about some of those opportunities that would be available, whether it's in the clinic setting or moving into some leadership roles that you might be interested in. But nonetheless, improving patient care is always on the list, advancing your career, and just kind of shaping the future of healthcare. If you're somebody who thinks you might be interested in teaching, we're always looking for faculty, whether it be adjunct faculty, full-time faculty. So a DNP degree is really helpful when you're thinking you might want to teach. Looking for higher level positions in your organization or other organizations, the DNP degree is preferred for those positions as well. Whenever we get higher degrees, we get higher level positions usually, which brings with it an increased earning potential. So that's a good reason to pursue this DNP degree. And like I said, improving patient outcomes with the information that you learn and can implement in your practice. So thinking about the program that we offer as somebody who's probably going to be working full-time while you're going through and pursuing your DNP, it's important to know that this coursework is 100% online, so you're not going to have to worry about trying to get to an in-person class or make it to campus. Our core courses, with that being said, are usually, the majority of them are asynchronous, meaning you don't have a set date or a time each week that you have to meet with your class. You'll have weekly modules and things that you need to complete and due dates within those weeks, but you'll get to work on that stuff at a time in that week that's most convenient with you with your work schedule. And then it says clinical courses are synchronous. And by clinical courses, that's usually the courses where you're working on implementing your research project, writing your research project. And by synchronous, we have a 1 hour office hour each week where we get together and kind of review where you are with your project, answer any questions that you have. And then our entire DNP program, it's 29 credits overall, and you complete that over 2 years. And most of those semesters are one class per semester. When it's two classes per semester, it's usually one class the first 7 weeks and the second class the second 7 weeks. So you're really doing one class at a time. There's only one semester where you have two classes sort of overlapping. And like I said, we did build the curriculum with working nurses in mind. So the coursework is flexible and able to be completed when is most convenient for you for the most part. All of our nursing programs here at Commonwealth are CCNE accredited, so that's always important to know. And the faculty that you'll encounter in our program are all advanced practice nurses, and most of us are in fact working in the clinical environment at this time. For the advanced practice track, 500 clinical hours are required for this degree, and they are built or incorporated into your coursework. A majority of those clinical hours are developing, implementing your project, kind of running the statistics, writing it, presenting it. And there are just a couple of courses where you'll find like 50 hours where you might be shadowing somebody in leadership or meeting with a senator or looking up some sort of bill or something like that. But most of them are directly related to your project itself. And then I said at the beginning what my project was about when I went for my DNP. Every student that comes through completes an evidence-based scholarly project. So it's kind of nice to start thinking now about areas in your work environment where you feel like maybe there could be some improvement or some new changes made that you might make be your quality improvement project. And then all of our students, they're currently working, so they continue to work, whether it be at a new job or the same job. So they're all employed after they graduate.
And Dr. Park, question for you, because I
Yeah.
know some students may be looking at the evidence-based project and even the clinical hours for that matter. But if I'm not mistaken, I feel like I've heard you say this before, that the clinical hours are kind of embedded within where they're working, right? And the evidence-based project is oftentimes a project that is relevant for their current role. So even though they're currently working and they're also currently taking classes, a lot of what they're doing is something that can be applied to their current position. Can you talk more about what that dynamic looks like?
Yeah, so that's why I said you want to start thinking now about changes you could make where you work, because it's really best if you can implement your project there. So some students will maybe implement a change in education, and then they'll do a pre-survey and a post-survey to see, was that effective? Did the patients learn? Or I've had students educate the staff and maybe see, did that make a change in how the providers maybe wrote prescriptions for upper respiratory infections or something like that. So if you implement it where you work, you can kind of do some of that stuff. Although you're not supposed to do all of it during work hours, you're going to ultimately be implementing your project during work hours, and then outside of there, you're going to be developing and writing and running your final statistics and things like that.
Thank you.
Yep, sure. This is just a list of the classes that you would be doing as part of your coursework. The DNP immersion role transition, really just an introduction to the role of a DNP, and even an introduction to our online environment. So if you're somebody who comes in here, maybe hasn't used Brightspace or desire to learn that learning platform, we kind of help you get used to using that. And that's just the very first course that you take by itself. And you also start thinking about what might be your topic topic for your study. So as you move through these classes, we're really helping you develop and implement and write your project. You're not doing it all on your own outside of these classes. Then there's informatics and technology as applied to advanced practice nursing, economics of healthcare and policy, all things that if you're going to have this doctoral degree, things that you should know and understand about the healthcare field and different organizations. Then you move into translating evidence, leadership, biomedical ethics, and your evidence-based classes. Those all directly pretty much pertain to your project and are going to really be helping you develop and implement and finish out, present your project.
In Dr. Park, would you be able to speak to like what does a normal week look like? And I know no 2 weeks are going to be the same. Like what is, typically what is the average amount of hours that students may be spending on coursework and projects to complete the DNP program?
I think in the first year, it's probably not as involved as the second year. In the second year, you're really implementing your project, gathering the statistics, running the statistics, trying to do a discussion, and then really presenting it maybe where you work, presenting it as a poster presentation. So that year is a little more involved. The first year is a little more of a slow transition, kind of just doing a little research and figuring out what might your topic be. And so that one, it's not, super easy, but definitely more easy than the second year. I don't know the exact number of hours. I would say I think it's different for everybody based on your background, what you know, how much do you know you're going to do as far as a topic for your project, how much do you know about that topic, that sort of thing.
And you talked about the core courses are asynchronous. The clinical courses are, no, the core courses are asynchronous. I'm sorry. Can you talk about what those courses are like for someone who may be jumping back into a graduate degree, having finished their MSN a little while ago? What are the asynchronous courses like? How do you normally facilitate them?
Yep. So the asynchronous courses, we use a lot of weekly discussions. So you would have to post an initial discussion by, say, maybe Wednesday or Thursday, and then respond to two of your peers by Sunday. And that's how we keep the conversation going, keep you in contact with each other. Maybe you can help each other sort of understand something or build upon a project or improve things in that way. And then on top of that, you might have some early on just some papers to write or small papers about your theory or things like that, but then as you go on, the papers that you write truly are your end manuscript, so you might start writing the introduction and things like that for your actual project.
Mhm. Great, thank you.
Mhm. I said I would get back to this and I would talk to you about career options, opportunities that might be available. I think a lot of people think about DNP and leadership roles, and that's certainly true. You might want to stay in your clinical role, and you might just want to be better prepared to understand evidence-based medicine and implement that for your patients, help everybody in your office implement that and improve patient care in that way. Or maybe you have your eye on leading your clinic or your office, or maybe higher up even in the organization. And that's certainly an opportunity. And this will give you the ability to understand that healthcare organization and how that relates to patient care. And maybe, make some of those leadership changes, and you can understand legal and financial issues. Maybe you want to be faculty. As I said, we're always looking for good faculty. You'll have a better understanding of research. So maybe you'll want to help with some research projects where you're working, and certainly you'll be equipped to do that. Sometimes we want to lobby for things for nurse practitioners. So you might want to be a healthcare lobbyist for your patients, for nurse practitioners. Always looking to not have to have the collaborative agreement that we have now, and that's something we're pushing for. So a lot of opportunities there with your doctorate.
Yeah, and I think one of the nicer things too, Dr. Park, you mentioned towards the beginning of the discussion here was that even for students and current nurses who may want to stay in their current role, it would at a minimum it would advance their scope of practice and help provide better outcomes for patients. So really, again, this is a degree program that really can
Absolutely.
offer a lot to any students.
Yep, I think helps you be better prepared to make some of those complex decisions based on evidence-based medicine and help everybody else in your clinic maybe implement that evidence-based medicine.
Mhm.
Sure.
Great. Thank you.
So the job outlook, this is the thing that a lot of us really want to know. So, what's going to happen when I'm done, right? And the Bureau of Labor and Statistics often looks at this, and the average salary for nurse practitioners, keeping in mind this can vary depending where you are. Are you in a rural area? Are you somewhere that's, really bustling? Are you in a specialty area? But the average salary about $120,680. And we also know that healthcare, nurse practitioners, nursing in general, this is an area that's really growing. And so there were about 112,000 and then some openings for nurse practitioners that are projected to be there over the next decade. And I think that's true because that demand is just increasing and increasing. And in fact, that demand is expected to grow about 45% leading up to the year 2030. So I think the job outlook is good. And then you look beyond the nurse practitioner, but even into some leadership roles, and that growth is probably even better.
Yeah, and I think when you see that the demand for nurse practitioners is going to rise by 45%, that's I mean, typically like
Mhm.
1 to 10% is pretty big.
Yeah, sure.
45% is humongous. I mean that yeah, this is a good time to be entering this profession 100%. Yeah.
Absolutely. Absolutely. I think that we have a lack of medical doctors, and we can fill that with all of us nurse practitioners for sure in a lot of ways. I can't see all of this. I need to move this. Okay. So if after hearing all of this, you think, yep, I'm ready to jump in. I want to take that next step. I want to start this summer. I need to get my information into Lori. Our application process is all online. Tom might be able to give you better information about where to go, but I know if you go to our online webpage, there's a link there to go and start that application process. Requirements that we have when you attended your MSN program, we want you to have had a GPA of 3.0 or better. If you didn't and it was slightly below there, let me know. We can talk about it, but that is what we prefer. You will need to provide transcripts from all previously attended institutions. So whether it was your bachelor's degree or your master's degree, we'll want to see those transcripts. And then we need proof, and this should come in your transcript, that you have completed advanced health assessment, pharmacology, and pathophysiology courses. And then the next thing can be the thing that a lot of times will tie up that application, and that's the letters of recommendation. And so we ask for those 3 letters of recommendation. I would let somebody know they're coming and even follow up with them on a regular to see that they took care of that for you. A current resume or CV, whatever it is that you usually use, is fine. And then you'll need your copy of your license certification as an advanced practice nurse, as well as a copy of your license as an RN. And then we need to have a total of 1,000 hours by the time you have your DNP. So we have 500 built into this. We need to know that you had at least 500 through your master's program. So we need a description and total number of your clinical hours and cases completed in that program with a verification from the director of that program. So those are the things we look for when you submit that application. Is there anything you want to add to that?
No, other than the fact that the application process, like the app itself, is brief. It should not take a lot of time. But I think Dr. Park made a really good point about the letters of recommendation. Typically, that's the part of the process that takes the most amount of time. So we can expedite that a little better just by giving your recommenders some advanced knowledge that this may be coming. And all of these items can be uploaded through your application portal. So a lot of these things are, again, they're very easy to facilitate. My team and I were certainly more than happy to help along the way. Dr. Parker, I do have another question for you. Is there anything else that you look for in a qualified applicant for the program? Anything that might not show up on a transcript, or like what are some things that you're looking for? Like, oh, you know what, this person may be a good fit.
Yeah, sure. I think somebody who really has some great ideas for change or really knows where they want to go, really has a focus. Gee, I'm really into leadership, or gee, I really love what I do, but here are some things I see that could maybe be improved. And so, they have that vision. Yeah, I think that's good.
And I know what are the semesters that you're accepting applications for, Dr. Park?
We like to do a summer start. So preferably for this summer, if you can get everything in, a summer start works best with the way the program is set up. If you start a little late, then you kind of get out of sequence and the classes build upon each other to help you with your project. And then you might end up having to double up and you might feel like a class you took isn't pertinent anymore, but you have to take it to complete the degree. Or you might feel like you missed something if you missed that class when you get into a later class. So, yeah.
Great, thank you.
And then certainly I'm always available if you do want more information, you want to talk more, you have other questions. So my contact email is here.
Yeah, thank you, Dr. Park, and we're
Sure.
certainly open to taking any questions from the people who may be watching live right now. I know we did have a great question here in the chat. For the program, do you typically accept transfer credits, and if so, how many?
We do. I don't know exactly how many. Do you know that answer?
Yeah, I believe, and I wanted to confirm, but yes, so we do accept transfer credits, and I want to say it's up to 12. Um,
Okay.
so yes, yeah, that's a great question. And again, if you have anything else, please feel free to put it into the Q&A or into the chat. Dr. Park, when you are working with students, what is the guidance like that students are receiving from faculty? I know a lot of this is it's probably more consultative. It's more almost like a peer-to-peer type
Correct.
session. So how does the advising work throughout the course of the program?
Yep. I have students say that they're very happy with the faculty. You're right, exactly. It is kind of peer-to-peer. We're advanced practitioners, you're advanced practitioners. We're just kind of helping you facilitate this project. And most of us are very open to being contacted outside of office hours. We often will give you our cell phone so you can text us, you can email us, you can get a hold of us. We're all very open to answering questions, helping you however we can to support you along the way.
Any advice for prospective students that may be wondering, is this the right time? Is this the right program? Any guidance for people who may be sitting on the fence?
Yeah, I I always say if you wait for the right time for so many things in life, I don't know that the right time ever comes, but if you feel like you can recognize those areas for change and you're ready for to move on and you feel that nudge to go for that next step, then it's probably the right time. But certainly, if you want to discuss it, reach out to me and I'd be happy to talk to you about it.
And we did get a question in the chat, which is also a very good one. Is the program delivered online? And it
Yep,
is
100%.
a combination of synchronous and asynchronous courses, but it is available 100% online.
I will say at the end, we do set up a day for everybody to set up their posters and do their oral defense in person. So if you live locally and you can do that, that's really great because that counts for some of your dissemination. But we do have the option if you don't live right here, we can set that up via Zoom as well.
Is there any interaction among the current students that are in the program? Or is it primarily just the student and yourself as a faculty member and the other faculty on staff?
So we do those discussion boards. So there's interaction in that way. Some of the students will have their own kind of side email chains, chats, that kind of thing. And then as we get to those final courses and we have those Zoom office hours every week, I think that's really helpful to get on and maybe be able to support each other and hey, this is what I found out. Maybe you want to know this or things like that.
Think that is good. So I believe that gets us through all of our questions. Um, Dr. Park, thank you so much. We
Sure.
appreciate your time. And for everyone who's watching us live or if you're watching the recording, thank you so much. Really do appreciate it. We certainly look forward to hearing from everybody in the future. And hope you have a great day.